Norovirus, a highly contagious virus responsible for causing gastroenteritis, was first identified in 1968 following an outbreak in Norwalk, Ohio. This discovery led to the virus initially being called the Norwalk virus. Over time, it has emerged as one of the most common causes of foodborne illness globally, affecting millions of people each year. The virus primarily spreads through the fecal-oral route, meaning it is transmitted when individuals consume contaminated food or water, or come into contact with infected surfaces. Another significant mode of transmission occurs through droplets in the air, especially when an infected person vomits. What makes norovirus particularly dangerous is its ability to survive for long periods on surfaces, even under unfavorable conditions, making it a persistent threat in high-traffic areas. This resilience allows it to spread rapidly in environments such as hospitals, schools, cruise ships, and restaurants. Several key factors contribute to the widespread nature of norovirus infections. First, it is extremely contagious, with even a very small number of virus particles being enough to cause illness. Additionally, norovirus is remarkably environmentally stable, capable of surviving both freezing and heating, as well as resisting common cleaning methods. This makes it hard to eradicate, even with thorough sanitation efforts. Another reason for the high rate of infection is the lack of lasting immunity to the virus. There are multiple strains of norovirus, and immunity to one strain does not provide protection against others. Moreover, the immunity one does acquire is short-lived, leaving individuals susceptible to reinfection throughout their lives. Finally, crowded settings contribute significantly to large outbreaks. Places where people live or work in close quarters, such as nursing homes, daycare centers, and cruise ships, provide ideal conditions for the virus to spread quickly from person to person. The combination of norovirus's ease of transmission, environmental resilience, and frequent mutation has cemented its role as a leading cause of gastroenteritis outbreaks worldwide. Norovirus has been a significant global health challenge since its discovery in 1968, leading to widespread illness and substantial social and economic disruption. Each year, it is responsible for approximately 685 million cases of gastroenteritis worldwide. The scale of infection is particularly concerning in countries like the United States, where it causes around 19-21 million cases of illness annually, resulting in 56,000–71,000 hospitalizations and approximately 800 deaths. While these figures are staggering, they only reflect the toll in developed countries. In developing regions, where access to clean water and healthcare is limited, norovirus is a leading cause of death from gastroenteritis, contributing to nearly 200,000 deaths globally each year. Norovirus outbreaks are especially common in environments where people are in close contact with one another, such as cruise ships, nursing homes, schools, and restaurants. These crowded settings facilitate the rapid spread of the virus, which can easily transmit from person to person or via contaminated surfaces, food, and water. Once an outbreak occurs, it can be difficult to contain due to norovirus's resilience. It can survive on surfaces for days and is resistant to many common cleaning agents. One of the key challenges in controlling norovirus is its ability to mutate, creating new strains that infect individuals repeatedly throughout their lives. This means that even those who have had norovirus in the past are not immune to future infections. Combined with its ability to spread rapidly and through various routes, this makes norovirus one of the most pervasive and difficult to control viral threats. To prevent the spread of norovirus, strict hygiene and sanitation practices are essential. Handwashing is one of the most effective ways to prevent infection, especially after using the bathroom or before handling food. It is important to wash hands with soap and water, as alcohol-based sanitizers are less effective against norovirus. In addition to hand hygiene, proper food handling is critical. Norovirus can be transmitted through contaminated food, particularly shellfish, so ensuring that food is cooked thoroughly and handled in sanitary conditions can help reduce the risk. Disinfecting surfaces regularly, especially in high-traffic areas like kitchens and bathrooms, is another key preventive measure. Norovirus can survive on surfaces for an extended period, so using bleach-based disinfectants is important to effectively eliminate the virus. In the case of infection, isolating affected individuals can help prevent the spread to others, particularly in communal settings like schools or nursing homes. Ensuring access to clean water is also vital, as contaminated water is a common source of norovirus outbreaks in areas with poor sanitation infrastructure. Safe water practices, such as boiling or filtering water, can significantly reduce the risk of waterborne transmission. By adhering to these preventive measures, the impact of norovirus can be mitigated, reducing its extensive reach and the significant harm it causes across both developed and developing regions. Norovirus continues to be a major cause of gastroenteritis, responsible for millions of cases worldwide each year. In the United States, norovirus causes an estimated 21 million cases annually, resulting in thousands of hospitalizations and around 900 deaths, particularly affecting the elderly, infants, and those with compromised immune systems. Outbreaks typically peak during the colder months, from November to April, though they can occur year-round. In 2024, areas like California have seen elevated norovirus activity, with increased detection through wastewater monitoring and numerous outbreaks in schools and long-term care facilities. Norovirus spreads easily in confined spaces such as hospitals, cruise ships, and schools, making it difficult to control once an outbreak begins. The virus can survive on surfaces for extended periods, sometimes for weeks, which contributes to its rapid transmission. Additionally, food contaminated by infected individuals or through contact with contaminated water can also serve as a vector for the virus. Preventing the spread of norovirus relies heavily on strict hygiene practices. Regular handwashing with soap and water is the most effective method to reduce transmission, as alcohol-based hand sanitizers are less effective against the virus. Surfaces should be thoroughly disinfected with bleach-based cleaners, especially in shared spaces or after someone has been sick. Proper food handling is also crucial, as norovirus can contaminate food if it is prepared by someone infected. Fruits and vegetables should be washed thoroughly, and food should be cooked adequately. Infected individuals should avoid handling food altogether to prevent contamination. By maintaining these preventive measures, norovirus infections can be significantly reduced, especially in high-risk environments like hospitals, schools, and care facilities.